Okay, hi Hugh, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and right now we're just getting a good look. The arthroscope is coming in from the back of your shoulder. That clear cannula you see is coming in the front of the shoulder through a part of the anterior shoulder that we call the rotator interval. The superior border here is this biceps tendon. Up here at the top of the screen looks pretty good, but look what happens down at the base. This is where it's torn. So you can see this torn tissue here and see how this anchor is unstable because of that. So we are going to do an axillary approach, that subpectoral tenodesis, because we've lost some tissue here that we can't repair that. And I'm afraid if we put this back, even this remaining tissue is not very healthy. You can see how that's frayed and doesn't look very stable. So what we're going to do is put in a pair of scissors here and release the biceps right at its insertion, so just right here. Okay, so now the biceps is released. That won't be a problem anymore. And next we're going to take the shaver and clean up some of these torn edges of labral tissue here. So here's the shaver coming in. And as you turn on the shaver, it's got suction attached to it, so that allows us to remove some of this torn tissue pretty quickly. So by removing that biceps tendon, it won't tug on this labrum anymore, and that's usually all we have to do. We'll keep working here, show you some more in a little bit. Okay, so now we've got that labrum debrided. We're going to have a look around the rest of the shoulder. Here's the rotator cuff. This is the undersurface of the part of the cuff called the supraspinatus tendon. And that looks just fine. You can see how it inserts normally into the humeral head there on the left, just to the left of the shaver. Hold the shaver, please. We're going to rotate around here and look towards the back of the shoulder. This is the posterior capsule, posterior labrum. And that insertion into the humeral head here looks just fine. You can see you've got a little bit of early arthritic change or just wear and tear changes in the cartilage. Nothing too severe. Remember, things are magnified quite a bit, so things that look large on the screen here right now are really just millimeters in size. And then here, as we look down the front of the shoulder, you see that. So we're going to go off on the video just for a minute. Hold the camera. Okay, so you can see some labral tears in the back, which is why we put the shaver back here. So we're going to start the shaver. And I don't think there's anything else really to do. You can see there's a little bit of condylar injury along the anterior edge of the glenoid, but nothing unstable. So we'll have a little bit more of a look around inside the joint, but I think the next thing we'll show you will be up in the subacromial space. Okay, Hugh, so now we're up in the subacromial space. We're just using this instrument to take away some soft tissue from the undersurface of the bone. Look up at the top of the screen, you can see how we're starting to expose the bone here. So now we've got the burr coming in from the back, and we're just taking off a little bit of this anterior lip of the acromion just to make more room for the rotator cuff. Hopefully this will be a little prevention from ever having a rotator cuff problem in the future as well, at least not from any type of impingement symptom. A lot of bone shifts. We're going to hold the camera, please. We're going to clear out our shaver here so it'll drain a little bit better. The anterior of the acromion, you can see how it's nice and flat now. That looks really good. Good. We'll just flush out the area. Now we're going to look down at the rotator cuff and just confirm that we don't have any problems on this dorsal side. Hold the camera, please. You see the shaver. Shaver in just to remove any bursal tissue that blocks our vision here. anterior portion of the cuff, that we'll be able to see in just a minute. And so you look down here at the anterior portion of the cuff, that looks great. Come down towards the mid portion of the supraspinatus, which is right below us basically. And then the posterior aspect of the cuff will be back here. Our final technique, we're just going to lift up the arm and rotate it. And as we do that, the rotator cuff looks great. No signs of any problems there. So we'll have one more good look around, but I think we're done with the arthroscopic portion of the surgery. We're just going to make a little incision in your armpit in just a minute. So that part is not videotaped because it's outside the joint, so I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.